And the UK Office for National Statistics says Black, Asian and ethnic minorities in the country are more than twice likely to die of COVID-19 than white people in British communities. The UK has registered above 30,000 coronavirus fatalities, a figure that's more than any other single country in the continent. Now, the revelations come on a day another report by academics made similar findings. The reports have triggered calls for the UK government to do more to shield the vulnerable BAME communities, most of who work in the front line against the virus, as well as address the social and economic inequalities. Well, let's bring in an expert on this, Dr. Nicole Andrews, a sociologist specializing in the study of health and illness. Dr. Andrews is a lecturer in health and social care at Newman University in Birmingham in the United Kingdom. Thank you so much for joining us, Dr. Andrews. Thank you for your time, really. Let's begin by looking at the latest statistics. What do the statistics really say? The BAME communities, how shocking is this?
Oh, well, good evening. Thank you for having me. I think with regard to these statistics, they are shocking. It almost doesn't feel like it's the right word to use, rather it's devastating. Each of these figures represents someone's loved one, represents a member of our communities who is no longer here. So when we think about these figures, it really is about trying to put the human face to this. I think in looking at these figures, as someone who explores health inequalities in a British context, these figures are not surprising. As Black and minority ethnic communities in the UK, we have long experienced a range of health inequalities. So whilst this situation is especially dangerous and especially poignant, the issue around health inequality is nothing new to UK society.
Indeed, but the findings are shocking, at least to say. What could be the major contributing factors to this disproportionate deaths and illnesses we're seeing?
I mean, looking at the situation, I don't think we could look beyond structural inequalities. So within the UK society, the difference between those who have and those who haven't is vast. And the outcomes because of that are represented in health outcomes, educational outcomes, etc. So if we look at the roles in society that Black and minority ethnic communities hold, whether it's employment and access to services, we can see that the disproportionate amount of people who are negatively affected by COVID have poorer health outcomes, poorer socio-economic backgrounds, and often have riskier professions that puts them in closer content to COVID, which is very, very dangerous.
One of the major contributing factor here is occupation. So ethnic minorities are key workers on the front line in the fight against COVID-19. What do you say to the suggestion that the UK government should shield them from exposure to the virus infections at a time like this?
I think it comes from a place of concern and fear, but only now because of COVID. And when we think about it realistically, it will be very difficult for the government to genuinely shield Black and minority ethnic communities. As, like you said, we are the key workers. We are the ones who are overrepresented when working in the care industry, working within the NHS, working within social services. We are also more represented in the gig economy. So those economies that are very forward-facing but rely on hours put in. So taxi drivers, people who maybe own their own businesses, people who do delivery and delivery services. And these jobs require a lot of interaction with other people. If you seek to remove Black and minority ethnic people from these roles, what would happen? The system wouldn't be able to continue and provide the services that are so necessary to respond to this COVID outbreak.
It is a dire situation indeed. But now, is there anything the BAME communities can do to reduce this heightened risk they face?
I think as communities, we are trying to support ourselves. I mean, if you sort of look at the news and it's a global picture, the lockdown has impacted lots of cultural and religious organisations and institutions that are no longer meeting. But that doesn't mean that communities aren't working together to ensure that people are fed, that people still have social access, that people are still felt to be part of society. I think what would need to happen is a real and honest dialogue between communities and the government. I think as a society, as communities, we can try our best to negotiate and manage these situations. But like I said, structural inequalities require a discussion top down as well as bottom up too.
And beyond that, I know you have said it is very difficult to shield these communities because of the key role they play. But if you are to advise the UK government on this subject, what would you be saying to number 10 Downing Street?
I would say that it is very sad that it has taken this situation for the UK to have a real and honest and open discussion about the role of ethnicity, about the role of structural inequality and the impact that it has on outcomes. And we've seen this in the past, whether we've looked at education, whether we've looked at other health outcomes. But I think COVID has made it so apparent and so stark that there is no ignoring the inequalities in this society.
Indeed, well said. But before we let you go, Dr. Andrews, you're an expert in this. Millions in Africa will be listening and watching you and wondering how these findings will affect how they should look after themselves and their families during this pandemic. Any words?
I think my words would be to listen to the health advice. The World Health Organization have been consistent in their advice to communities. Maintain the best levels of hygiene that you can. And social distancing is very important to flattening the curve, as they say. So following advice, but similar to the UK, people's realities sometimes make that difficult. If you have to go to work because you have to pay rent, because you have to buy food, because you have to be able to buy clothes, it's then about making the safest options for yourself and your family available. So maybe is there somewhere else you can stay rather than going home? Maybe is there a way that you can shield your family when you go home? Maybe avoid lots of social contact. But the reality is that when you live in situations where you have to work and social distancing is difficult, it's about trying to do your best to maintain distance.
Dr. Nicole Andrews, expert in health and social care and based at the Newman University in the UK. Thank you very much for your time here on The Rise News. Stay safe.